This slide highlights some of the risk factors for cardiovascular disease, and I'll use it to show some of the research that staff at Liverpool John Moores University are doing in this area. First of all, we have smoking, a well-known risk factor for both lung disease and cardiovascular disease. Researchers in the Public Health Institute have looked at interventions to reduce tobacco use. The work provides policymakers and practitioners with the latest evidence on tobacco control policy and practice. They have examined a range of topics, including tobacco industry denormalisation interventions. They've looked at ways to reduce tobacco use in young people and the relationship between smoking behaviours and things like demographics, income, parental smoking, leisure activities and alcohol consumption. High blood pressure or hypertension and obesity are also well-known risk factors for future cardiovascular disease. Researchers, including those in the School of Sport and Exercise Science, have examined a range of different interventions to reduce both blood pressure and obesity, including a number of different types of exercise training. Diet and cholesterol will also lead to future cardiovascular disease risk. Researchers in the university have explored the risk in relation to various phenotypes and genotypes of obesity. A range of interventions, including the effects of higher protein diets with resistance exercise in cardiac rehabilitation, the effects of carbohydrate-restricted diets, and the impact of green tea on lipoprotein subclasses. It's now recognised that physical inactivity can lead to future cardiovascular disease. Staff in the Physical Activity Exchange have examined and evaluated the effects of physical activity and sedentary behaviour on health and well-being. Using robust measurement techniques, they explore factors that affect participation in physical activity and sedentary behaviour, and look to design and evaluate interventions to change these behaviours. In conjunction with external partners, this also informs policy and practice. Colleagues in the School of Nursing and Allied Health have noted that people rarely make lifestyle decisions in isolation, and are therefore undertaking a number of studies to explore how family-focused support can influence long-term behaviour change. Alcohol can also lead to future risk. Individuals in the Public Health Institute have undertaken research into a range of alcohol-related topics. They've evaluated interventions, reviewed evidence and delivered original research into alcohol consumption and harm across a range of different populations and settings. Diabetes is growing in the Western world, and it is known that the majority of people with diabetes will die from cardiovascular disease. Colleagues in the School of Nursing and Allied Health, along with staff from psychology, are exploring the shared risk factors of these conditions and how healthcare professionals can support patients to adopt healthier lifestyles. Likewise, researchers in the School of Sport and Exercise Science have implemented various exercise interventions, including home-based exercise or high-intensity interval exercise training in individuals with type 1 diabetes and in those who have risk factors for type 2 diabetes. Finally, we have blood vessel health. Although not a traditional risk factor, the role of blood vessels in the development of cardiovascular disease is well known. Researchers in the School of Sport and Exercise Science have looked at a range of dietary, exercise modes and novel interventions to improve the blood vessel health in people with different risk factors. I hope this slide has highlighted some of the risk factors and prompted you to look at our work, and I've provided some links here. More importantly, I hope it's helped you to decide to adopt healthy lifestyle decisions.